Hey guys, I'm Risha.
I'm Ibrahim,
and we're the Mandinka Family. And today we are attending a mental health program that we were invited by Basiru. We interviewed him on part 1, so he invited us to this training seminar. So you guys stay tuned.
Stay tuned, guys.
You be my queen, you be my screensaver. I be a king, no be cinema. Diamond, mineral, situation critical. You be my queen, you be my screensaver. I be a king, no be cinema. Diamond, mineral, situation critical. Sun kiss your body, glitter, glitter.
Good morning, welcome. In other words, Diana Gamma. Although there is limited data showing the prevalence of mental health illnesses in the Gambia, anecdotal evidence shows that mental health illnesses is prevalent, especially in the Greater Banjul area within the country. According to WHO data that was shared by the Chronicles in October 2020, 27,300 individuals suffer from severe mental disorders, and 91,000 suffer from all mental disorders, which is quite a significant number. Also, the National Health Policy document between 2012 to 2020 shares that over 180,000 people will suffer from mental health or suffer from mental health conditions, and of this, a limited number will be able to access mental health care services. Ladies and gentlemen, nominated trainees, members of the media house present, I cannot begin to overemphasize the importance and significance when it comes to providing health care service for mental illnesses within the country. In this regard, I want to say that people's mental health can be compromised by various factors, including sexual and gender-based violence. Examples of this are intimate partner violence, such as sexual violence, physical violence, and even emotional violence. Also, I would like to include verbal violence. It can also be affected by non-intimate partner violence, violence from family members, from the military, from the schools, from their workplaces, and a very impeding topic that has been going on for quite a while now, female genital mutilation or cutting, which research has shown that it does indeed affect people's mental health, leaving them with symptoms of postpartum depression and some mood disorders, such as anxiety and the like. Also, several research has shown that the link between sexual and gender-based violence and mental illnesses, and some has even shown the correlation to maternal mortality, as well as fetal impairment. For a while, there's been a lot of advocacy about the rates of, and even on a global perspective, there has been intervention to try and reduce this. A key and crucial aspect of it includes mental health. Although limited still, shows that maternal mortality and fetal impairment is, and this still highlights the importance of why we need to put more focus, especially interventional focus, on mental health illnesses. UNFPA the Gambia, through the Peace Building Fund, has come in a milestone towards ensuring that Gambians' well-being are catered for holistically, especially individuals going through sexual and gender-based violence. In this regard, I would have loved to call, if the person representing UNFPA is present, Joy. She can please come and take the podium and shed light on their endeavors to see that all Gambians have access to mental health services.
Good morning, ladies and gentlemen. I'm really greatly honored to be here this morning. Thank you so much, Peace of Mind, for inviting me. And UNFPA is really looking forward to this collaboration. This is our first time engaging with Peace of Mind to address critical issues. As you can hear from the statistics this morning, there are no better time to address mental health concerns than now. It should have been yesterday, but we have the opportunity of today. And we are glad we are able to form this partnership with Peace of Mind to be able to address this concern. For us, we are concerned about improving the livelihood of women and girls, and whatever concerns women and girls is of a concern to UNFPA. And that's why we have gone into this partnership as part of our GBV response to improve mental health of GBV survivors in the Gambia. And from the staggering statistics that we are hearing this morning, it means that we have a whole lot of work to do in addressing mental health. Mental health affects everything that concerns us as an individual. It's very important because it affects both our emotional health and can decide on how we relate with others within our community. That's why maintaining a positive mental health and treating any mental health condition is crucial to stabilizing constructive behaviors, emotions, and thoughts.
Mental health has been a problem in the Gambia. I remember since I started working at the Department of Social Welfare in 1997. This is a gap that we have been struggling with, and we want to thank Peace of Mind and UNFPA for coming up with this great initiative to train personnel who would go back into the field and go back to their work environment to support people that have suffered sexual and gender-based violence or other social problems that might lead to mental health or psychosocial problems. The Network Against Gender-Based Violence has alluded to before is an institution or an organization that is a membership-based organization. It was formed out of the thinking of many of us who in 2009, 2010 thought the Gambia needs to do something to address issues of sexual and gender-based violence. At that time we used to call it just gender-based violence. But we have shown the increase in the number of cases of gender-based violence, especially sexual violence and domestic violence or intimate partner violence. And as people at that time and concerned people we thought that we need to do something. We need to ensure that something is done to address this problem before it reaches out of hand. And as a result, I could remember one Hadimboj Barrow, who is still with us, has retired but not tired, was the first initiator of the forming of the network against gender-based violence. He called some of us that he has been working with in this area to start discussing what to do to ensure that we address sexual and gender-based violence. I can recall some of the founding members, such as Mr. Kajali Sonko, who is now the DPS at the Ministry of Gender, Children and Social Welfare, Mr. Njundu Drami, who used to be the National Coordinator of Child Protection Alliance, Mr. Sidi Khan then was at the Gambia Police Gender and Child Welfare Office and was a very instrumental man. Now he's working at the Human Rights Commission. Madi Jobate was one of the pioneers as well, and one Matilda Johnson, who is now running the National Library. And the list go on. But this were, and my humble self, of course, we were the most instrumental people who formed just a committee to start discussing and conceptualizing about what to do to address sexual and gender-based violence. We used to come from our different offices to KMC, where we would sit and start discussing. And that's how the network was formed, initially as a committee that sits, discuss, and go and do some advocacy to address some of the issues. And it evolved up to a time when we decided to write a proposal, and from there we got a proposal that was funded by the Finnish Foreign Ministry.
Alright guys, as you can see, these are some of the healthcare workers. They are out for a tea break, heading to a spot for where they're gonna have their tea break.
Cheers! Alright guys, so these are, most of these people are mental health professionals here in the Gambia. As you can see, it's a nice amount of them. I find this really, really nice, and I hope over time, even more people come into this profession to be able to help, because like, one of the panelists was saying that in the rural areas, even though it's getting better, they still need a lot of help. They still have a long way to go. So this is the beginning, and we're calling the Diasporans who have a degree in psychology to come over here to Gambia, come help these people out, set up some programs, some training programs.
That would be great, if that is to happen. That would surely be great. That would be, of a great help when the diasporans are to come out here to help, us, elevate and better understand, have a better understanding on mental health care. Well, for me, that this is something that I don't know much about, but now I am getting to understand and have some lessons about it as I attend some of their events. I am getting aware of certain issues regarding it.
Absolutely. And we want to thank Basiru for who you guys seen on part 1. We want to thank Basiru for inviting us to this event. This was a great turnout, and you get to learn from the actual locals what it's like, how mental health is impacting the country of Gambia, but in the local societies as well. So, guys, stay tuned. All right, guys, so we have one of the panelists here that attended the program today. Can you introduce yourself and where you're from? What do you do as a mental health worker as well?
My name is Faluso, and I'm the National Coordinator of the Network Against Gender-Based Violence. So as a network, we provide social workers and train them to provide psychosocial service to people who are affected mentally, but also survivors and victims of sexual and gender-based violence in the Gambia.
Okay. Now, one interesting thing that I have learned so far in this seminar is that, or in this training, is that there's only one clinical psychologist in the Gambia. And Gambia, you know, even though it's the smallest country on the mainland of the continent, is still a big country.
Yeah.
Full of people. So are there any proposed ideas to get some more clinical psychologists to come and help spread mental health awareness?
Yeah, as a civil society organization, we've been advocating to that, and we hope that government and other partners like UNFPA will take it up. We are happy that we are having a kind of a training today that relates to it, and we hope that they will go beyond that to train people who will be specialized in mental health and psychology and even psychotherapy to be able to really support and assist people who have these problems to heal. Yeah.
Okay.
Yeah.
And just my last question, if for supporters out there, people who may not be aware but they happen to watch this video, if they want to come and support this cause for mental health, is there any organizations or any contact numbers that they can reach?
Okay, they can reach Peace of Mind, which is the main organization that is working in that area in the Gambia. But they can also reach through the network against gender-based violence, because Peace of Mind is a member of the network.
Okay.
So if they reach us, we would definitely do the link between them and Peace of Mind. And other organizations like Will that also are doing some work in that area so that they can support them. Yeah.
Okay.
Yeah.
All right. Well, thank you so much
thank
for
you
your
so
time.
much. Thank
All
you
right.
too. Yeah.
Thank you. All right, guys. So I hope you enjoyed this video. And you guys were able to take away something from some of what the panelists were saying. We didn't get to interview or we didn't get to record all of the panelists because there was a lot of them, and the training seminar was from 9 o'clock to 5 o'clock in the afternoon, so we didn't stay the whole time. But we hope you did take something away from the parts that you guys did see. Of course, if you want to be able to attend events like this, if you're in the Gambia, reach out to Basiru. Just click the link in the description box for part 1, and he has his contact information. How can they reach us, babe?
Okay, you can reach us through the Mandinka Family on Facebook or the Mandinka Family on Instagram, or send us an email through the mandinkafamily@gmail.com.
All right, guys. You guys have a good day. And as always,
Black love is black power.
See you guys.
Are you